everyone, and good afternoon. I would just like to start off by saying thank you for attending my presentation on care coordination. Today's presentation will focus on the importance of care coordination and what nurses can do to make sure there is proper assessment, planning, implementation, communication, and reassessments of the patients. We will discuss the definition of care coordination and how it benefits all involved. We will take a look at the nursing code of ethics and policies that can impact care coordination. Please feel free to stop me at any point if you have any questions. But before we get into this big discussion about the effects that care coordination has on patient outcomes, let's review what care coordination actually is and stands for. According to the Agency for Healthcare Research and Quality, quote, care coordination involves deliberately organizing patient care activities and sharing information among all of the participants concerned with the patient's care to achieve safer and more effective care. This means that the patient's needs and preferences are known ahead of time and communicated at the right time to the right people, and that this information is used to provide safe, appropriate, and effective care to the patient, end quote. This was provided by the Agency for Healthcare Research and Quality. The goal of care coordination is to improve patient outcomes by organizing and combining patient care services to eliminate impartial care, reduce hospital readmissions, and to eliminate the need for any unnecessary tests and procedures that will result in unplanned costs. It is a joint effort that needs the patient and their family to be involved in the planning, discussing, and considering the risk and benefits of treatments and respecting the patient's right to autonomy. Healthcare coordination is vital to improve patient access to healthcare, education, compliance, and coordination of follow-up care. Care coordination has become a priority in the healthcare system. Stakeholders are now seeing care coordination as one of the most important ways that we can improve goals related to clinical outcomes, management of chronic disease, reduce medical errors, and costs of care. The Hospital Readmissions Reduction Program, or HRRP, is a policy that reduces payments to hospitals with large volumes of readmissions. Better care coordination will improve patient outcomes post-discharge and will help lower the number of readmissions seen within an organization. HRRP is encouraging better communication skills and a more effective strategy at tackling care coordination to engage patients and caregivers to take more interest in their care post-discharge. Care coordination planning needs to start happening immediately upon patient admission to the hospital within a patient's treatment timeline. When a patient is sick with multiple different illnesses, they have multiple specialty doctors attending to their case. It is easy for the patient to receive fragmented care. The immediate action of starting to care coordinate increases the communication and collaboration between doctors on a specific case. In the end, more care coordination efforts between all of the healthcare providers will help to reduce costs and lower the rate of readmission. Evidence and case studies are making waves in the changes of what we know and what will be the environment of healthcare. A study showed that patients with 2 or more chronic conditions are 13% more likely to receive fragmented care. This is going to result in return trips to the emergency room. Another evidence-based study that has been shown to decrease fragmented care is to educate patients on the different aspects of their care. They need to be educated on what conditions they have been diagnosed with and what that means for them in terms of short-term and long-term goals. Patients, a majority of the time from my professional experience, do not know what medications they are taking, let alone why they are taking them. Patients should be able to have discussions about their health and be able to understand it in order to increase their likelihood of compliance and engagement in treatment. Education can not only lead patients to have a greater understanding for their condition, but also better engagement in treatment activities, which will lessen the rate of readmission. Registered nurses are a key aspect of the interdisciplinary team in care coordination. Nurses are the main link of communication with the patients, discussing their needs and knowing every aspect of their care. Nurses are the voice between all points of care, from the pharmacy to radiology to family and physicians. They provide education to patients and their families on what medications they are taking and what conditions they are being treated for. They collaborate with providers regarding the plan of care, treatments, and appointments. In 2019, an article was released by Swan that recognized the nurse's ability to provide quality and effective care coordination. A few of the diseases that were mentioned for effective use of care coordination was conditions such as COPD, dementia, special care pediatrics, post-stroke, diabetes, heart failure, disabled individuals, oncology patients, patients in skilled nursing facilities, and patients receiving hospice care. Coordinating care has been a practice of nursing prior to the actual acknowledgement of the term, which means that this process has been around for a long time and we are still trying to improve it. The American Nurses Association identified care coordination as a professional standard for all registered nurses. Nurses are at the center of their patients' needs. Nurses have the ability to use the care coordination skills and interdisciplinary team wisely to help a patient reach their healthcare goals. Nurses involves providing safe, high-quality, culturally sensitive, patient-centered care. This means care that considers the patient's cultural values, beliefs, and social needs. Each patient is different, so each care plan and each approach must be thought out differently to involve differences in language, communication, religion, perception of pain, and family involvement. The United States is the country of many cultures, hence why it is called a melting pot. As nurses, there will be times when language and communication will be a very big challenge in the way of effective care coordination. It is up to us to use appropriate interventions when we have patients who do not speak our native language or who need special accommodations. It is crucial that we understand the influence that our interactions have on the patient. It affects their care experience regardless of cultural background and regardless of any situation. Elements of care coordination involve easy access to healthcare services, effective communication strategies, and care plan transitions between providers, a total health approach to target all of the health needs of a patient, and giving clear and simple information that is easy to understand, according to NEJM, the Catalyst. The plan of care cannot be in a complicated, complex form. It needs to be easy to understand, including educational material for everything the patient needs to know, such as medications, procedures, and their new and past diagnoses. These patients should have a list of all providers with phone numbers when they have follow-up appointments scheduled, the date, time, and location of the appointment to ensure the patient and their family has all the correct information to make the process as smooth as possible. NEJM Catalyst lists 3 types of care coordination which must be considered during planning. Primary care coordination, acute care coordination, and post-acute long-term care coordination. Primary care is to provide care for chronic, established diseases. Acute is for emergent issues where new issues are surfacing that need immediate attention. Post-acute or long-term is coordination of patients that are in rehab, long-term, or post-acute care. Within all 3 types of care coordination, there still must be a continuum of care coordination to keep in mind cultural and ethical guidelines. Each type of care coordination has different considerations which must be made. That requires a specialized care team for the specific patient, lots of care coordination, and an interdisciplinary team that can communicate effectively to have the best result possible for the patient. Nurses must always remember the ethical principles of autonomy, justice, beneficence, and non-malfeasance. When providing any type of patient care, nurses have a moral duty to follow actions that support delivery of effective health care services. Patient information is shared amongst providers caring for the patient, and it is imperative that HIPAA standards are upheld to protect the patient's private health information. The American Nurses Association Code of Ethics includes 9 provisions. The first provision, nurse practices with compensation in respect for the inherent dignity, worth, and unique attributes of every person. Provision 2 addresses the nurse's primary commitment is to the patient, whether an individual, group, family, community, or population. Provision 3, the nurse promotes, advocates for, and protects the rights, health, and safety for the patient. Provision 4 states the nurse has authority, accountability, and responsibility for nursing practice, makes decisions, and takes action consistent with the obligation to provide optimal patient care. Provision 5 states that nurses owe the same duties to self as to others, including the responsibility to promote health and safety, preserve wholeness of character and integrity, maintain competence, and continued personal and professional growth. Provision 6 addresses nurses through individual and collective effort, establishes, maintains, and improves the ethical environment of the work setting and conditions of employment that are conducive to safe, quality health care. Provision 7 advises the nurse in all roles and settings, advances the profession through research and scholarly inquiry, professional standards development, and the generation of both nursing and health policy. Provision 8. The nurse collaborates with other healthcare professionals and the public to promote human rights, promote health diplomacy, and reduce health disparities. Lastly, Provision 9 states the profession of nursing, collectively through its professional organizations, must articulate nursing values, maintain the integrity of the profession, and integrate principles of social justice into nursing and health policy. This was quoted by the American Nurses Association of 2015. With taking this into consideration, this is what the nurse has to do and maintain. Care coordination is complex and requires compliance across the healthcare system involving patients, doctors, family, and anyone else involved in the patient's care. Nurses must always remember to be culturally sensitive and open to new ideas and ways to help their patients reach their healthcare goals. Well, I think that about wraps it up, everyone. I really thank you for taking the time to listen today, and I hope we all learned something new from this presentation or got a refresher of information. Remember, communication and education are key to your patient's health experiences. It will help reduce the cost of health care to both the patient and to the hospital. Nurses must make sure that their patients are receiving adequate education about their healthcare conditions and that they understand everything. When a patient is discharged, care coordination does not stop there. We must make sure that the patient is following education, medication regimes, and attending follow-up care appointments. Nurses are the cheerleaders